it's just hocus pocus. No, it's not. It's science. Okay, so we want to start our discussion of the overall skeleton, starting with the center portion, also known as the axial skeleton. So the axial skeleton is going to be the central part. So think of kind of like a wheel and axle, okay? And so this is the main center part where sort of everything else revolves around to a certain extent. So we've got the head and the trunk. Now that separates it from the appendicular skeleton, which we'll talk about in the next video, which is your arms and legs, right? So we're focusing on just this main section right here, these 80 bones of the axial skeleton. There are 8 bones that make up your cranium and 14 bones that make up your face, right? So basically from about here down is your face, and then your forehead back is your cranium. There's also 6 bones associated with well, actually technically it's 7. There's 6 auditory ossicles. Those are the bones of your inner ear, and then your hyoid, which is in your throat. You've also got the thoracic cage, more commonly referred to as the rib cage, that has the sternum, and then here in the middle, and then the 24 ribs down the side. And then we have the vertebral column, which is your backbone, basically, but it's not one solid bone. So there's 24 vertebrae, plus the sacrum and the coccyx, which is down towards the bottom. All right, so the axial skeleton supports and protects the organs of the body cavities. It also provides muscle attachments for muscles that move the head, adjust the position of the head, the neck, and the trunk, right? So that's your chest and your abdomen. Perform breathing movements. So when you're actually breathing, that's movement of the muscles that are attached to your rib cage. And stabilizing parts of the appendicular skeleton. And so those will provide points of attachment for your shoulder girdles and your pelvic girdles, which we talk about in the next video. So let's start with the head. Okay, so the skull contains 22 bones, like we said, 8 cranial bones that make up the enclose the cranial cavity, where the brain is. And this includes the skull cap, which is kind of about here-ish, basically. And then there's also 14 facial bones. And their primary function is to protect and support the entrances, if you can see over here, of the digestive and the respiratory tract, so nose and mouth, right? And they sort of provide that shape and provide support to hold those open and stuff like that. We also have, so within the facial bones, let me back up a little bit. There's 9 superficial facial bones, and so those are the ones here on the surface. They're primarily for muscle attachment, sort of gives tone to your face and lets you open your mouth and chew and stuff like that. And then there are deeper facial bones, so if you were to go back this way into your head, kind of underneath where your eye sockets are, moving immediately towards the center, those are going to separate oral and nasal cavities. So like basically there's a bone that's essentially your hard palate, for example. Increases the surface area of nasal cavities and help form the nasal septum, which is a structure that basically creates, like a barrier, right, in between where you're behind your nose, that creates 2 separate channels, basically. And we also have the associated bones, the hyoid bone, which is in your throat, and the auditory ossicles. And those are enclosed in the temporal bones, and we'll talk about those here in just a little bit. Now, they're associated because they're part of the head, but they're not actually attached to any other parts of the skeleton. So they're associated with the skeleton, but they're not attached to, like your hyoid is not attached to your vertebrae, and your auditory ossicles are not attached to the bones in your skull. Within the bones of your skull, you have special structures called sutures. Now, sutures are immovable joints of the skull. When you go into the joints activity, you're going to look at different types of joints. This is one of those, okay? There's 4 major sutures that you need to know of based off of your study guide. And those are the lambdoid suture, coronal, sagittal, and the squamous suture. All right, so here are those sutures. First one, let's talk about the lambdoid suture. And so the lambdoid suture is going to be back here in the back. It's this half moon thing right here. And that's gonna be the juncture between the occipital and the parietal bones. And you may have some of those wormian or sutural bones embedded in here that we had talked about in the first video. Then we have the coronal suture, which attaches the front bone, the frontal bone, with the parietal bone. So it's this one right here, and it goes across like this. The third one is the sagittal bone, is the sagittal suture, which is running down the middle right here. It's going to join the 2 parietal bones, left and right, and it's also going to connect the frontal bone and the occipital bone with those 2 sutures right there. And then the squamous suture, the last one in here, is joins the temporal bones over here on the side with the parietal bone and the occipital bones. And these are immovable joints. And we'll talk about what that's like in infants. With infants, the skull is not solidified, and there's a couple of reasons why. We'll get into greater detail about that in a little bit later. All right, so the cranial bones that we're talking about, we've got the occipital bone, the parietal bones, the frontal bone, the temporal bones, the sphenoid, and the ethmoid bones. And so let's take a little bit of time and let's talk about those here for just a little bit. We'll start with the occipital bone. That's the one that's towards the back. The general functions are to form the posterior and inferior surfaces of the cranium, and it's joined with the parietal bones, the temporal bones, the sphenoid, and the first cervical vertebrae, which is known as the atlas, and we'll talk about that here in just a little bit. And so here is that occipital bone. It forms the base of the skull and the back of the skull. A couple of important regions and markings that we need to know about. One of the main markings are the occipital condyle. And those are where the first vertebrae of your back articulate with the skull. So that's the point of attachment. And then there's, as far as foramen or foramina, so it's the plural form, there's multiple holes basically. We've got the foramen magnum, which is this structure right here. And that's basically where the spinal column, the nerve bundle, enters into the brain. And then you have the jugular foramen. Now the jugular foramen, it's kind of hard to see on this particular picture. We'll show it up again. It's like here-ish, basically, and part of it is formed by the occipital bone and part of it is formed by some of the other bones that are anterior to this one. And this is where the jugular vein enters the skull to help with blood flow for the brain. Then we have, here's another view, I apologize. Here's another view showing the skull. Okay, so next, moving anterior and up the head is the parietal bones. Now there are 2 of these. There's one on either side right here. Their primary function is to form the superior and lateral surfaces of the cranium, and they join with each other here in the middle at the sagittal suture, as well with the occipital back in the back, the temporal on the sides here, the frontal, and the sphenoid bones, which are about here-ish, okay? Moving on, then we have the frontal bone right here, which basically forms the forehead of the skull. This is the anterior part of the cranium and the roof of the eye socket. So the frontal bone comes all the way to here where our eyebrow ridge is. And then these sockets are actually formed by a number of other bones that end up coming down this way towards the face, including the ethmoid, the nasal, lacrimal, maxillary, and zygomatic bones. And it also contains the front sinuses up here. So if you've ever had a sinus headache, for example, that's what you have going on right there. Then we have the temporal bones. So these are going to be the ones here on the sides, okay? And they're going to be primarily responsible for forming the lateral walls of the cranium and the zygomatic arches, which is this section right over here. They articulate with the mandible. So coming down over here, your mandible is your bottom jaw. So if you feel about here-ish or so, that's where your mandible is going to attach to your head, basically. It surrounds and protects the inner ear. So your inner ear is actually sitting inside of your temporal bones. Other joints that form here are the zygomatic, sphenoid, parietal, occipital bones, and the mandible. Continuing with the temporal bones, there's a number of different regions on this one, including the zygomatic process, the mandibular fossa, mastoid process, the styloid process, and the auditory ossicles. So the first part is the zygomatic process, which is this arch-like structure right here that will continue moving anterior towards the face. It articulates the temporal process of the zygomatic bone and creates the zygomatic arch. And so that's basically your cheekbone right here, is that zygomatic arch. Then we have the mandibular fossa, which is just behind it, this flat space right here, which is the site of articulation for the mandible. Then we have the mastoid process, which is down here at the bottom. That's a site of muscle attachment for your neck muscles primarily, and it contains mastoid cells that connect to the middle ear cavity, and that's where your auditory ossicles are. The styloid process, which is this little projection right here, attaches to tendons and ligaments of the hyoid, the pharynx, and the tongue. Here's an interior view of the skull, and so we have. So right about here is the carotid canal for the anterior carotid artery. Now remember, the occipital bone forms the other part of this, like in the posterior half of this canal. A couple other structures we have: the external acoustic meatus, which is this hole right here. Now, if you picture outside of, so like if you look at my ear, there's the ear canal that goes in and it terminates at the tympanum, which is the eardrum. And then from there, the eardrum sort of sits right here and it fills that in. Moving past that tympanum, you're going through the external acoustic meatus into the middle ear where those auditory ossicles are. Now there's another structure on the other side of that that's the internal acoustic meatus, and that's where the inner ear is, and then the auditory nerves that go into the brain. The auditory ossicles are three little bones that would fit on the surface of a dime. They are remarkably tiny, remarkably delicate, and their function is to transfer sound vibrations from the tympanum to the middle ear. Now there's three bones. They are the malleus, also known as the hammer, the incus, known as the anvil, and the stapes, it's known as the stirrup. And so basically what happens is the malleus is attached to the tympanum. The tympanum vibrates. the malleus kind of acts like a hammer, and so it starts vibrating, and it knocks up against the incus, which is the anvil. That impact vibration is transmitted to the stapes, or the stirrup, which is then attached to the inner ear, which sends vibrations into the inner ear that we detect as sound and motion and stuff like that. And we'll get into more about how all that works when we get into special senses with the nervous system. Another bone we have is the sphenoid bone. Now, generally, it forms the floor of the cranium. It unites the cranial and the facial bones. So you don't see that bone. It strengthens the sides of the skull like a support strut. It has the sphenoid sinuses. It joins with the ethmoid and frontal bones, the occipital, the parietal, and the temporal bones, as well as the palatine bones, the zygomatic bones, the maxillae, and the vomer of the facial bones. And so here's the sphenoid bone, and it kind of looks like some sort of weirdo flying structure, like a bat or something like that. A couple of regions that we need to keep in mind, that we need to know about. This structure right here is known as the greater wing, that extends laterally from the body, and this is where it bonds to the rest of some of the other bones to form the cranial floor. And so if you look at this first picture right here, this is a superior view looking inferior. Here's the foramen magnum, where the brainstem comes through. And so you can see the points of attachment, and you can see how this completes the base of that cranial cavity. The foramen that we need to know about, there is the foramen rotundum and the foramen ovale. The foramen ovale is the biggest one that we need to know about, so it's right there. The foramen rotundum is right there. And those allow access for blood vessels and nerves from the brain to the face and the jaws. Now we have the ethmoid bone, which is a relatively small bone anterior to the sphenoid. It forms the anterior-medial floor of the cranium, the roof of the nasal cavity, and part of the nasal septum and the medial orbital wall, forming part of the eye socket. It joins with the frontal bone, the sphenoid, the maxillae, the nasal, the lacrimal, the palatine, the inferior nasal conchae, and the vomer, which are all facial bones. Okay, so it's another sort of juncture between the cranium and the facial bones. All right, so then the facial bones, let's talk about those for a little bit. There's a number of those. We've got the maxillae, the palatine, the nasal bones, the vomer, the inferior nasal conchae, the zygomatic bones, the lacrimal bones, the mandible, and the hyoid bone. Remember, there were like 14-something bones. Some of these are paired. Okay, so that'll make memorizing things a little bit easier. All right, so starting with the maxilla. The maxilla is the upper jaw, essentially. It supports the teeth. It forms the inferior orbital rim. So this part right here, all of this bone right here, if you sort of press on your face, that's all maxilla going down to your teeth right here. Stay towards the center, okay? The lateral margins of the external nares, so the nose basically right here, you can kind of feel, if you press inward, you can kind of feel a little bit, but there's all cartilage right there. Forms the upper jaw and most of the hard palate going back. I can't really see that. That's okay. And then the maxillary sinuses, which are the largest sinuses, and so we're talking about these sinuses right here. It joins with the frontal bones, the ethmoid, and with each other, and then all the other facial bones except for the mandible, which really only articulates with the temporal bones. Then we have the palatine bone, which all right, so next in our cavalcade of bone parade or something, I don't know. I think I screwed up euphemism or something. And anyway, it doesn't matter. So next we have the palatine bones. The palatine bones are going to form the posterior portion of the hard palate and contribute to the floors of the orbits, your eye sockets. They're going to join with the maxillae, with each other, with the sphenoid, with the ethmoid, the inferior nasal conchae, and the vomer. Then after this, we have the nasal bones, which are going to be these bones right here. They support the bridge of the nose, so this bony part right here. They are going to connect to cartilage of the distal parts of the nose that extend to the external nares. So basically, it's the point of attachment for all of this squishy stuff, and the external nares are these two holes right there, basically. They join with each other, with the ethmoid, with the frontal bone, and with the maxillae. So it's sort of like a juncture in between these two. It's going to come across like this, right? Then we also have the vomer, and the vomer is an interior bone, so it's in here right there, okay? It's going to form the interior portion of the bony nasal septum. It's going to join with the maxillae, with the sphenoid, the ethmoid, and the palatine bones. And it's also going to join with the cartilaginous part of the nasal septum. So the if you go internal, so this part right here, going back into your head. Then we have the inferior nasal conchae, which is this bone right here and right here. And they're going to slow the inhalation of air, create turbulence within the nasal cavity, which helps sort of move the air and come in contact with structures designed to help filter the air that's coming through, and to increase the surface area to warm and humidify inhaled air. It's going to join with the maxillae, with the ethmoid, the palatine, and the lacrimal bones. Zygomatic bones contribute to the rims and lateral walls. So we're looking at this side over here and down in this section. Remember how I said it makes up your cheekbones, basically, and forms the zygomatic arches. And it joins with the maxillae, the sphenoid, the frontal, and the temporal bones. Now we have the lacrimal bones. The lacrimal bones, this inside bone right here and right here. They're the smallest facial bones. They're going to form parts of the medial walls of the orbit, so the inside part you can't really get to. It joins with the frontal bone and the maxillae and the ethmoid. And this is one of the ones that has a marking that we need to know about, and that's the lacrimal sulcus. And the lacrimal sulcus is the location of the lacrimal sac where the tear production happens. And it leads to the nasolacrimal canal, which connects nasal passages. It's a drainage portal basically for eyes into nose and stuff like that. Going down, then we have the mandible, which is the lower jaw that articulates to the temporal bones. And that's pretty much the only place that it attaches to. Other than that, it's free to move around independently from the rest of the facial features. Okay, so one of the things that's interesting about the skeleton is there are definite differences in sex as far as the bone structure is concerned. For example, looking at this, typically the skull in females is lighter and smoother, slightly smaller. However, I'm going on the record as saying that does not have anything to do with differences in mental capacity. It has to do with physical size. Females, on average, are smaller than males, and so that's going to translate into skull size, okay? Forehead is more vertical instead of sloping in males, smaller sinuses, smaller teeth. That's going to coincide with an overall smaller skull size, a smaller, narrower mandible, whereas in males, it's the opposite. And so, medically speaking, there's a lot of, you can tell archaeologically, forensically, you can determine the sex of human remains based on the size of the skull. You can also do that with the hips, and we're going to talk about those in the next video. Okay, moving away from the skull then, we have the hyoid bone. That's the last accessory associated bone, and it's going to be right here, kind of situated above your pharynx. Its primary function is to support the pharynx, and then it's a point of attachment for the larynx muscles, pharynx muscles, and your tongue. It attaches to the stylohyoid ligaments, connects the hyoid to the temporal bones, but otherwise it doesn't connect directly to anything else. Okay, then the actual sinuses. So we mentioned those a couple of times. Those are air-filled chambers connected to the sinus cavities that help lighten the skull, lighten the bones of the skull, and they contain mucous epithelium. And so that's epithelial cells primarily responsible for producing mucus and releasing it into the nasal cavity. Mucus is part of it's an immune system thing. It's full of white blood cells, and it's primarily its primary function is to trap foreign particles. And we'll talk about that when we get into the immune system a lot more in the spring. So your skull doesn't really change once it fully forms, once you get into like adolescence, into adulthood. However, as an infant, the bones of your skull are loosely attached by structures called fontanelles. And fontanelles are sections of connective tissue that allows the different bones of the skull to move around, and so there's a little bit of a malleability to an infant skull. That also allows an infant skull to grow very rapidly. Most of that growth is going into adulthood, as far as the skull is concerned, is characterized by filling in those fontanelles with bone tissue. And this allows the skull is not solid to aid in the baby traveling down the birth canal, because if the baby's head was solid, it wouldn't fit through the mother's pelvis and out of the birth canal. So if you've ever seen babies born, their heads are slightly misshapen, and then after a couple of days it sort of gets the regular baby shape. And then if it doesn't, there's special helmets that can be prescribed that help basically force the baby's head back into shape. Now, they don't hurt. They maybe look a little weird, but I mean, they're babies, so most people think babies are either cute or weird regardless of what happens to them, so it doesn't matter. And then eventually these fontanelles will fill in with bone through regular bone development processes until you get to pretty close to the final size, and then further bone development will let it grow out a little bit more. Okay, so moving away from the head, now we're moving inferiorly. We're coming up to the vertebrae, the spine, the vertebral column, that protects the spinal cord and provides support for the head and the body. There's 26 bones, 24 vertebrae, plus the sacrum and the coccyx. Now, within the column, there's also 4 curves, and you need to know these curves and where they are and what their purpose is. And so those 4 curves are the cervical curve, the thoracic curve, the lumbar curve, and the sacral curve. Now, what's easy to remember about these is it corresponds with where on the vertebrae those are happening. Cervical curve is up here with the cervical vertebrae of the neck. Thoracic is in this section. Lumbar is lower back, and sacral is your seat, basically. Okay, so some bits of information about the different curves. The thoracic and the sacral curves. So we're talking about this curve right here, and this curve right here are known as primary curves or accommodation curves, and their primary function is to accommodate the internal organs, and those curves are present during fetal development. Now, the other ones come after birth. The cervical and the lumbar curves are known as secondary curves or compensatory, and those allow the body weight to shift to an upright posture as the baby is growing up. And I think that may be one of the reasons why babies can't hold themselves up. Now, the other one is that their muscles are woefully underdeveloped, and so they have to strengthen those muscles in order to be able to pick their head up and sit upright and stuff like that. All right, so the actual vertebrae themselves are the bones in the neck, and there's 3 different kinds of vertebrae. You've got the ones, or no, I'm sorry, not in your neck, in your entire back. Okay, so you have 7 cervical vertebrae, which make up your neck. You have 12 thoracic vertebrae, which make up your upper back, and each one articulates with 1 or more pairs of ribs. And then you've got 5 lumbar vertebrae in your lower back. Now, they're structurally very different, and this has to do with their location and what they're primarily designed to do. Each vertebrae has 3 parts. The main part is the vertebral body right here, and that's where the weight transfer along the spine takes place. And it forms the anterior margin of the vertebral foramen. The vertebral foramen, which is this hole right here, is where the spinal cord passes through. And I've got another shot to see what that looks like too. You've got the vertebral arch, which is this right here. And then the articular processes, which are these structures right here. And those are points of attachment between the different vertebrae. Okay, so we've got other structures. We have the spinous process right here, which you can feel if you run your fingers down your back, the little bumpy parts that run down the center. That's the spinous process of each one of your vertebrae. You've got the transverse processes, which stick out to the sides. Okay. And then we have the superior and inferior articular processes. That's where like I said, where the neighboring vertebrae connect to each other. In between each vertebrae, in between the discs, or in between the vertebral body, are discs of cartilage known as the intervertebral discs. And these provide flexibility and cushioning, like shock absorption, between the vertebrae. You have the intervertebral foramen right here, where the spinal cord passes through. And then the vertebral canal, which is formed by the successive vertebrae. So it basically kind of looks like a tunnel that's got spaces in it that you can look through and stuff like that. The vertebrae are numbered based on their region going from top to bottom. C1 articulates with the skull. That's the first one, the highest one. And then L5, the lowest one, articulates with the sacrum, which is part of the pelvic girdle. Each vertebrae have characteristics that are specifically determined by their functions. So we've got cervical, thoracic, lumbar, sacral, which makes the sacrum, and the coccygeal, which makes up the coccyx. Starting at the top, we have the cervical vertebrae. There's 7, so C1 through C7. One of the defining characteristics is the anterior edge. So this side right here is inferior to the posterior edge. So like if you look at some of these, like this one right here, this edge is lower than this edge, okay? They have a very small body because their only purpose is to support the head. They have the very large vertebral foramen, this part right here, because that's the largest part of the spinal cord. By that point, all of the nerves have sort of gathered up all together and they're just going straight into the brain. They have concave superior surfaces. These are by far the smallest of the bones. And actually whiplash, if you've ever experienced that, that's dislocation of these cervical vertebrae. They also allow head movement by way of the atlas and the axis. Those are two specialized vertebrae. So the atlas is the first one. And it articulates with the occipital condyles of the skull. And those are the projections at the base of your skull. It doesn't have any body or spinous process whatsoever because it doesn't articulate with anything else. It just articulates with the skull. They have a very large and round vertebral foramen with very large anterior and posterior arches. And that forms a joint that allows you to move your head around. Okay, and give us the range of movement that we usually do. Number C2 is known as the axis. The axis articulates with the atlas, and that's it. It has a very heavy spinous process that neck muscles basically will attach to. During development, these processes will smooth together to create something called the dens. And these two bones allow you to swivel your head back and forth because of this ligament right here, this transverse ligament. All right, moving down from those then, the other cervical vertebrae, C7 is the vertebrae prominens. That's the one that basically transitions from the cervical to the thoracic vertebrae. It has very long spinous process and a large transverse process. Then there's a ligament that is responsible, that sort of holds everything together, that goes from C7 up to the base of the skull, and that's the ligamentum nuchae. It's an elastic ligament. Moving down below that, we have the thoracic ligaments. They have vaguely heart-shaped bodies, so that kind of looks heart-shaped, like anatomical heart, not Valentine's heart. Larger bodies relative to a smaller vertebral foramen. They have long and slender spinous processes, and then they have costal facets, which I'll make sure I highlight those that are points of articulation for the ribs. Okay. T1 through T8 here all articulate to two pairs of ribs on the sides. T9 through T11 articulate to one pair of ribs. T10 through T12 are your transitions they're also your transitions to your lumbar vertebrae. Lumbar vertebrae then they're the largest vertebrae. They have the largest vertebral body, very thick oval shaped. They have a triangular vertebral foramen. This is where you have lots of points of attachment for your lower back muscles for supporting the weight of your body. So very large, pronounced spinous processes on the side. On the back, transverse processes on the side. Moving down from there, L5 articulates with the sacrum, and then the sacrum articulates with the coccyx. The sacrum is curved. Now, it's more curved in males than in females. Females, we don't want it to be curved so much because that impedes fetal progress baby's progress through the birth canal. It attaches to the axial skeleton. It attaches the axial skeleton to the pelvic girdle, which is technically part of the appendicular skeleton. And it attaches to broad muscles that move the thigh. And the primary function of the sacrum and the coccyx is to protect the reproductive, the urinary, and the digestive organs in the pelvic cavity. A couple of things that we want to point out on this one. The sacrum is actually 5 fused vertebrae into one solid unit. And this fusion occurs between anywhere from puberty up until 25 to 30. there's a canal that runs the length. It starts right here. That extends the length of the sacrum and has nerves that run from one end to the other. And then finally, the coccyx, which is also known as the tailbone. It has 3 to 5 coccygeal vertebrae. It attaches ligaments that go to muscles that constrict the anus and so control opening and closing. And that's basically it. It's easily broken if you've ever sat down too hard, basically. Moving away from the back, we've got the thoracic cage, also known as the rib cage, and this is the skeleton of the chest. And it consists of the thoracic vertebrae, you can see back here, the ribs, which you can see right here, the costal cartilages, which are these dark red, sort of maroon-looking structures right here and right here, and the sternum, which is this middle part right here. The functions of the rib cage are to protect the organs, including the heart, the lungs, and the thymus, provide attachment for muscles involved with breathing, maintaining upright position, and moving the pectoral girdles. And I guess that's it. Okay. So the ribs are long, curved, flat bones. We've got 12 pairs of them. They extend from the thoracic vertebrae, wrap around to the sternum. Now, there's two types of sternum. There's two types of ribs. There's true ribs and false ribs. Okay, so the first 7 ribs, so up to here, are true ribs. And they're called that because they connect to the sternum directly through these costal cartilages. And the cartilage is what allows your chest to expand when you breathe in. If those there's a disorder where those tissues can actually be replaced with bone, and so your breathing is severely restricted, and that causes a lot of problems. The other ribs, 8 through 12, are false ribs. They don't attach directly to the sternum, and so you can kind of see through here, 2 or more ribs will attach to the same costal cartilage. And those cartilage was actually fused together. Now, 8, 9, and 10 are actually attached to costals. 11 and 12 are not attached to anything. Those are known as floating ribs, and those are the point of attachment for muscles of the body wall, but they don't actually attach to the sternum in any way. The sternum itself is also known as the breastbone. It's a flat bone anterior to the midline of the thoracic wall, so right here. It has 3 main parts: the manubrium, the body, and the xiphoid process. The manubrium is this top section right here. It's very broad and triangular shape. It's a point of articulation for the clavicles, which are the collarbones right here, and the first pair of ribs. Then beneath that is the body, which the remaining true ribs will attach to. And then beneath that, the xiphoid process is this part right here. You can kind of feel, you can kind of feel it about here. There's a little bit of an arch right here, and then just inferior to that, you can kind of feel there's a hard, almost like tongue that's sticking out. It attaches to the diaphragm and the rectus abdominis muscles. The developing sternal body consists of 4 separate bones that eventually fuse together, and they fuse completely by the time you're 25. And the xiphoid process is the last to form and ossify, and it can also break off very easily. If you've ever gone through CPR training, you've probably been told that it's very easy to break that bone off while you're administering CPR. Well, I thought we had more, but apparently that's it. Keep on keeping on, folks. If y'all have any questions, send me an email, send me a remind message, ask me in class. Otherwise, I look forward to seeing y'all again soon. Stay tuned for part 3 of the weekend edition, where we talk about the appendicular skeleton. I guess that's it. Thank y'all very much.